Oh my gosh, Mr. Speaker. He talks and he talks and he talks and he dances and he dances and he dances, but he doesn't get anywhere near the facts. You know, Mr. Speaker, I've been in this legislature a long time, 15 years with the government, now a member of the opposition a year and about 6 weeks. And there's a reason that happened, Mr. Speaker, and it's something that one doesn't take lightly after being a member of the Progressive Conservatives since 1976. And I reflect back to the press conference that I was at on the 4th of January last year. And I reflect back on the rationale that I gave Albertans and the reasons why I crossed the floor. And one of them, the number one priority at that time, Mr. Speaker, was health care. And, you know, and I quietly listened to this minister and sat here thinking, no wonder I left. You know, I don't know if the government thinks that as members of opposition we have tea together every day and we sit around and we chat about how we're going to take down the government. And we get together and we have beer and we have lunch and we have coffee and we even maybe pray together about how we're going to take the government down together. Mr. Speaker, what happened last Friday was unprecedented. You do not get opposition members coming together in a joint press conference and agreeing. And, you know, you had the member of the opposition from the Liberal Party, the Wild Rose. You can have your time to speak, Mr. Treasury Board. And he's giving me this. Albertans should see this and see how polite the government members are on the other side. That's Minister of Treasury. For Albertans that are watching, that's how seriously he thinks this debate is. We had the independent member, we had a member from the NDP and a member from the Alberta Party, which in my mind is unprecedented. I just want to make something, and I'm going to read a letter that I received. I want to make something very clear, and I want to make it crystal clear. The government minister has said that we do not support the Alberta Medical Association, nor do we support the College of Physicians and Surgeons. I want it on the record that this, as Wild Rose, we support the AMA, we support the College of Physicians and Surgeons. I've met with the AMA. We've had numerous discussions about what's happening with health care. We've discussed and talked to the College of Physicians and Surgeons, and we have a great deal of respect for what they do in this province. I will talk about, though, as the health critic for the Wild Rose, and the number of calls, the number of emails that I'm getting in regards to what is happening. And I tabled a document in the House today from a doctor that I'm going to call Dr. Y. And the reason I'm reading this into the record is I would probably guess that 80% of the people sitting in this legislature right now haven't bothered to even look at the tabling, and I need to have this in the record. I received this from him today. Many of us within the system were not surprised. We had noticed the problem worsening over time, and the ongoing lack of leadership was evident. There are so many of us wanting to do the right thing for patients, but who are working in fear if we speak out. The culture continues to this day. It causes moral distress as we are placed in an impossible position. What has been especially troublesome was the direct observation among peers that no level of public dissent would be tolerated by the health region, in brackets he's put, I work in Capital Health, or by the latter AHS. I have direct knowledge of several health professionals who were negatively impacted by their efforts to advocate for better health care. They were silenced or worked out, or discredited, one after the other. I have also been negatively impacted by this muzzling of physician voices, and this culture of silence was simply reinforced. Anyone questioning the status quo would also be dealt with rapidly and effectively. Like colleagues around me, it was evident that the political decision makers had a strong hold on what has become a centralized, non-patient focused health system. Like many other physicians, I felt and continue to feel intimidated by AHS and government. Many of us are afraid to advocate for our patients, yet we have an ethical duty to advocate in the best interest of our patients. We have repeatedly observed the punitive consequences in those who did so and realize that the risk is immensely high. With the involvement of the AMA, optics couldn't be worse on call standees about Sherman's mental health, November 30th, 2010, Edmonton Journal. Many of us realize that the age-old strategy of discrediting dissenting voices were perhaps now at play. We learned that upon a phone call from Honourable Horner, Dr. White started questioning the mental stability of Dr. Sherman. Like has been the case with other outspoken doctors in the past, innuendos appear very effective in making an example of Sherman. Physicians were reminded, yet again, that this fate might befall them if they choose to speak out against the system. The voices of several physicians were drowned out of fear for their repercussions simply because the political appetite was not aligned with the advocacy efforts. Our moral distress continues, and it is getting worse. Why is the Health Quality Council mandated to only investigate the wait times and cancer deaths? What about the slew of suicides we've experienced in Alberta? Like the one some of our politicians knew about during the ceremony at Villa Carteros, but no one spoke a word. Anything short of a judge-led public inquiry with full power and accountability will not restore any level of trust in this government and its health portfolio. Many of us feel that we may be beyond a point of repair. Physicians are intimidated.
We have a point of order. What's your citation?
23 HINJ. With respect to the comments the honourable member is making, she just referred to a suicide at the Villa Caritas. The honourable member is not allowed to skirt the rules of the House by reading from a document. Whether using the names of members in the House, which she's used several times, or by casting aspersions on a member. So by reading someone else's comments, she's adopting them as her own, and she is casting aspersions on a member of the House. The Minister of Health, a number of days ago, in response specifically to a question, indicated that he had not any knowledge of the suicide until it was raised in the House, which was after the ceremonies, and the honourable member ought to know that.
The honourable member for Chestermere on this point of order.
On the point of order, in the interest of time, I will keep it short, but I will just say that this honourable member is reading a letter from a healthcare health professional, and she has every right to read those words into the record. She's not adopting them as her own. She's saying that this is more evidence that exists, and she's reading it into the record. So for this member to say that that is not permitted is utter nonsense, Mr. Speaker. Utter nonsense, Dave.
Well, I'm willing to rule on this. First off, yes, the honourable member did mention the names of members in the House here. I know the honourable member said that she had tabled this particular letter earlier today. That doesn't give her the levity to actually use their names. I let that go. I was waiting to see whether you were going to continue using them or not and ask you to withdraw that, but you didn't use them anymore, so that's fine. With regard to that, it is, as far as I can understand it, the letter was tabled. You're reading a letter that was tabled, and with that, I don't call it point of order.
Thank you, Mr. Speaker, and I apologize. And you are correct on the reading the member's name, so I will call him the member from Edmonton Meadowlark. And you know, the doctor that received this or sent us this letter doesn't understand the House protocol, so anything short of a judge-led public inquiry with full power and accountability will not restore any level of trust in this government and its health portfolio. Many of us feel that we may be on a point of repair. Physicians who are intimidated do not make the best partners in rebuilding the healthcare system, and Albertans continue to pay the price with their lives. As I do not consider myself immune to reprisal from those within AHS and the government, I respectfully ask that you keep my identity secret if you wish to refer to this letter in any way. Wow. Mr. Speaker, the point is, I guess, as we sat in this legislature in December and debated yet another emergency debate on health care about the length of times in emergency. And the government stands up and they pretend that they all of a sudden are interested in that. The letter came from a Dr. Parks in 2007, and I can guarantee you, as a former member of this government, that that would not have become front and center if it had not been leaked to the press. And all of a sudden, we're dealing with all of these emergencies. The Minister of Health stands up and he brags away about the protocol and talks about his emergency protocols that he's put in place, and he feels like he's, you know, the star. Then he starts talking about the 1,300 continuing care beds that he's putting into this province. Well, I can tell you, Mr. Speaker, there is a huge shortage of long-term care beds in this province. So the government can brag all they want about the continuing care beds, but as the minister has indicated, I don't think he's talked to people. Let's talk about the seniors. When they can't fit into the continuing care model anymore and all of a sudden they have nowhere to go. I live that every day when I deal with my mom at her assisted living, and some of the seniors that are dealing with that, I brought that up to the Minister of Seniors during estimates, and I guess that's another subject for another time. Let's just talk about the Health Quality Council that